Y'all ready? Well, good morning. Wonderful to be in Jacksonville. And I want to recognize Dr. Zachary Faison, President and CEO of Edward Waters College, also Mayor Lenny Curry, Mayor of City of Jacksonville. And then I think we have Representative Davis, and then I think we have Commissioner Newby, and then we have Mia Jones, CEO of Agape Family Health Organization. So welcome to everybody. It's a great announcement today as you see what's going on. So a couple weeks ago, we were looking at what was going on in the state, and we had a lot of really great efforts with vaccinating senior citizens, particularly in Palm Beach County, because we had put in a lot of retail pharmacies. We saw those numbers going up. But as we saw that, my lottery secretary, who's from the farthest west portion of Palm Beach County out in Pahokee, said, hey, can we get some more vaccines in this area? They don't have the retail pharmacy. They don't necessarily have the healthcare infrastructure. So we went there, we brought it, and we said, you know what, we should just make this permanent here, but then we should replicate this model in other parts of the state. And so we were planning on being here last week, but the Moderna got delayed because of the ice storm. It was sitting in the warehouse for a week. Now last week's Moderna is here and this week's. So Pahokee is the first permanent site, but we're also going to add another 5 permanent sites. And again, the goal here is to be able to reach out anyone who may fall through the cracks, who isn't necessarily have access to a retail pharmacy or not necessarily a hospital. This is important, and so I want to thank Edward Waters for stepping up and being willing to get involved here. We also are going to have FAMU in Leon County, Kissimmee Community Center in Osceola, Broward College down in Broward County, and Oak Park in Miami-Dade County, and Overton Youth Center also in Miami-Dade County. And so these sites will offer at least 200 vaccines a day. And this particular site here at Edward Waters is being coordinated in partnership with Agape Family Health Services. So we want to thank them for their involvement and thank them for making these vaccines even more accessible to folks throughout the state of Florida. We really have a lot of momentum on the vaccine. We probably have already hit this because the reporting's delayed, but we're reporting over 47% of our massive senior population has received a vaccination. 4.5 million seniors. It's not easy to get through when you have a big state and all those folks. And so we're proud of that momentum. We want to build off of it. But I also think if you look around the state, there's certain bright spots. Northeast Florida has been a real bright spot. In Duval County, over 55% of all seniors have received a shot. And again, these numbers lag by a couple days, so it's probably close to 60%. St. Johns County, 75% of seniors are reported to have received a shot. Nassau, 67%, and Clay, 54%. So Florida, to be at almost 50% statewide, that's much better than almost probably 45 or 46 other states. And so for Duval to be ahead of the state average, St. John's way above the state average, Nassau, that's really, really good. And I can tell you, if you look at how this works, when you have a big county like Duval, you have 1 million people, it is just more challenging than when you have a smaller county with a little smaller population. So I think that the folks here in the hospital systems have worked good. The health department, obviously the mayors worked really hard on this, and we now have a lot of retail options, which we think is good. So Northeast Florida is doing a great job. We obviously want to keep it going. I don't know how many seniors are going to actually opt for it. Some will not. We know that because we've gone through the nursing homes, and not every nursing home resident has asked for it. But when you see 75% in St. John's, we got to figure that we need to get from 50% at least up to 75% over the next couple weeks, and so that's what we're going to be working to do. We're proud to be able to announce on Tuesday a massive expansion of retail pharmacies in Miami-Dade County, which had not had as many options as most other counties. And so there's going to be 81 stores, CVS-related stores in Dade, which is good. Now, in Duval has some of the ones with the other pharmacies that we've been doing. So we have almost 600 Publix pharmacies statewide. 25 Publix pharmacies here in Duval County are offering shots for senior citizens. We have almost 120 Walmart and Sam's Club combined throughout the state. 18 Walmarts in Duval County are offering shots, and then 43 Winn-Dixies throughout the state. 5 of those are right here in Duval County. So we think the retail footprint is greatly improved here in Duval, and I think those numbers, which have gone up nicely, I think you're going to continue to see it. If people want to make an appointment for any of those, Publix is publix.com/COVID vaccine. Walmart is walmart.com/COVID vaccine. Winn-Dixie is winn-dixie.com/pharmacy/COVID -vaccine. So we think the retail is really good. And as we get more of these vaccines, like the Johnson & Johnson and some of these other things, retail is going to play an even bigger role. We also are proud of doing over 65 events with faith-based organizations, mostly churches, and predominantly African-American churches. So in Duval, we've done over 2,000 vaccinations through the faith-based program, one at the St. Matthew Baptist Church, one at St. Paul AME, and one at St. Stephen AME Church. And we're continuing to do that. As we get vaccines, we are making sure to dedicate more to the places of worship program. Very important just to inspire confidence that these vaccines are safe and effective. And when you have somebody that's an authority figure that people trust, like a pastor, it does make a difference, and you're able to get more people, and I think you have a higher participation rate. And of course, we have almost 90 community vaccination sites throughout the state of Florida. Duval, you have almost 10,000 Pfizer vaccines a week at Regency Mall, which is great, and we want to continue with that and hopefully be able to even increase that as we get more vaccine. We've also done events where we go to senior-heavy communities and do thousands of vaccines over the course of a couple days. We were just in Hernando County at a kind of a manufactured home facility, and we're doing almost 2,500 seniors there yesterday, today, and tomorrow, and we're going to continue to be able to find high concentrations of seniors and really make a good impact with that. We're also continuing with our Homebound Seniors program. We've done over 1,300 seniors. We started with Holocaust survivors. We've also done Bay of Pigs veterans, and now we're doing a lot of World War II and Korean War veterans. And so we think that that's something that's it's very warranted for those folks. These are people that we really look up to. Jacksonville is going to be one of the sites for the collaboration we're doing with FEMA and the federally supported site. So basically, the federal government is just providing additional doses, which is great. It's not coming out of our state's allotment. So additional doses, and it'll be enough to do 4 sites throughout the state. So it'll be Miami, Tampa, Orlando, and then here in Jacksonville. And that's going to add additional. Now, we're effectively going to have to run it, but the feds are providing the supplies and the vaccine. And at the end of the day, we just want more vaccine. So if you're sending it, we are going to use it. And we're excited about that. We're also going to be having the opportunity, because of these new sites, for the first expansion. Look, we're seniors first. And that was what we did at the very beginning. We were very clear on that. Other states have now followed Florida. The CDC had to backtrack. Seniors first is the right thing. At the same time, as we have Johnson & Johnson, as we have all these other things now coming to bear, we're continuing to do seniors first, but we also will be able to start expanding, and we're going to expand with law enforcement and classroom teachers that are 50 and up, so stay tuned for that announcement next week. And then we're also looking at the most effective way to use this Johnson & Johnson vaccine. It's likely going to be getting an EUA approval tomorrow probably, or Saturday, so within the next few days. There is Johnson & Johnson vaccine that's already been produced. They are going to ship it immediately. I don't know for sure how many vaccines that means for the state of Florida. We think it's going to be tens of thousands. I mean, I hope it's more than that, but at a minimum, we think it'll be tens of thousands. So we're going to take that Johnson & Johnson and apply that in the way that makes the most sense. There's been, I think, some unfair information about Johnson & Johnson trying to say it's not effective. If you look, it's a single dose. You take it one time, you don't have to worry about it. In the clinical trial, it was 100% effective at preventing death and virtually 100% effective at preventing serious hospitalization. So that is great. And yes, there were more infections than Pfizer, but they were almost all mild. And so if you take something that could be life-threatening and you're taking it to where either you'll be immune from it or it'll be reduced to something like the common cold, that is a huge plus. So we believe Johnson & Johnson is going to be a great tool, and we're going to work with with different folks to figure out what's the best way to apply that. So we're working on it today and tomorrow. And then by beginning of the week, we'll have an announcement about, once we know how many Johnson & Johnson vaccines we're going to get, what the best way is to apply that throughout the state of Florida. But all in all, we are seeing, of course, the COVID numbers go down, big declines in nursing homes, I think because of the vaccinations, and I think we'll start to see similar with the senior community very soon. This thing has kind of a pattern to it. I mean, last March and April was a little bit higher in parts of the country than February or May. So we may see that as we get into March or April, but I think we're well prepared for it with the vaccines, with the therapeutics, and obviously we have robust hospital capacity. So keep going with seniors first. This is a great additional step. We're glad to be here at Edward Waters, and I think this is going to be it's exciting that it's going to be a permanent site, and we're going to continue to work to get as many vaccines here as we can. So, Doctor, do you want to come up and say a few words?
Well, greetings and good morning from the state of Florida's Destination Institution of Emerging Eminence here at the Edward Waters College, which happens to be our state's first independent institution of higher education and first historically black college or university. Governor, as you know, it was precisely almost 1 year ago that this horrific malady known as COVID-19 began gripping our world, nation, and the citizens of our beloved state. As we grappled with the realities of this ongoing pandemic through the spring, summer, and fall of 2020, the word came near the end of last year that a vaccine was indeed on the horizon. And so while many communities around our nation and our state really ballyhooed its arrival, other portions of our community, particularly some portions of the African American community, met the news with some understood fear and trepidation and consternation, and even a high level of distrust, given the past well-chronicled and sometimes difficult history that our community has with the medical community in both the public and private sector, highlighted, of course, by the Tuskegee syphilis experiment and the Henrietta Lacks saga. But, Governor, I want you to know that as soon as word came that pursuant to your leadership, our state would be the beneficiary of this much-needed vaccine, we at Edward Waters College, along with many other faith-based organizations like the AME Church, with which Edward Waters College is directly affiliated, we began to distill truth and educate here in our community through our college's Center for Health Disparities, our Shell Suite Senior Center. We began to do our work to assuage fears in the African American community around this vaccine. But, Governor, we knew that it would be a two-pronged approach. That one approach would be, of course, providing information and educating our community, but the other part was to make sure that there was equitable access to this vaccine. And that's where you, Governor, have stepped in and filled the gap. And this is very significant in helping to not only, again, get the word out and distill truth and get accurate information out there, but also to provide equitable access to this vaccine to this very, very, very important Newtown and Northwest Jacksonville community. And so it was, again, Governor, your leadership and willingness to provide this vaccine, particularly for this community, that we find so significant. And we are very pleased and excited to be a part of this effort. And so we thank you, Governor. Certainly, we are excited to be in partnership with Agape Family Health and Mia Jones and their team that will be responsible for distributing the vaccine. Excited to be able to work in partnership with them. And certainly the partnership that we have with our Mayor Lenny Curry, the members of our City Council, and just everyone that has really collectively worked very collaboratively with regard to the work that's been ongoing here in Jacksonville to impact positively our citizens here in this community as we grapple and continue to work our way through this COVID-19 pandemic. So again, we are excited about this and look forward to this being, as the governor mentioned, a permanent site for vaccine distribution to the citizens of this community. Thank you so much.
Good morning, and always great to welcome our governor to Jacksonville. And Governor, I want to thank you for your accessibility, for always taking my call, for members of your team always taking my call to hear our concerns and helping us solve our problems here in Jacksonville. You have been fantastic. I want to thank my colleagues, our Council Vice President Sam Newby and Brenda Priestley Jackson, for our collaboration in many of the issues facing Jacksonville, specifically COVID-19. Brenda and I were on the phone last night. We were home with our families talking about how we can best serve the people of Jacksonville as we navigate this. So thanks to both of you. Hope is alive, and hope is alive because of a plan and a strategy. People are being vaccinated. The governor just gave you the numbers. Our schools are open. Thank God we live in Florida. Our schools are open, businesses are operating in a safe and responsible way, and we are at a tipping point, I believe, in the near future to turning the corner and getting back to a sense of normalcy. I want to remind people that we are administering second doses at our Clanzell T. Brown Senior Center on Moncrief Road. So folks can get their second dose there, and it's just good to be here this morning.
Good morning. It's a pleasure to be able to be here. I would like to thank the governor and President Faison and our mayor. Agape Family Health has been a trusted resource within our community since 2004. In 2016, we became an independent organization and stood up 5 clinics across our city. We have been a part and in partnership with the mayor over the past few months in providing COVID testing at various locations throughout our city, and we are looking forward to adding this to the next step of us being a major partner within Jacksonville of making sure that the citizens of Jacksonville are protected against COVID-19. Because of our clientele at Agape, we are a federally qualified health center providing healthcare services for insured and uninsured patients. We are a medical home that is committed to making sure that those who are in vulnerable communities are served and served with respect. So today, as we open this site, we look forward to continuing those efforts. We appreciate the work that President Faison is doing here on the campus of Edward Waters College, and we look forward to making sure that as our community faces all that goes along with COVID-19, that we are ready to serve them and provide the necessary support that they need. Thank you so much.
Well, I just want to again thank Edward Waters for stepping up and being a part of this, and also just again to recognize Jacksonville and Duval County. When you have close to 60% of your seniors vaccinated, that is so much better than the rest of the country. That's ahead of even Florida, which is one of the leaders in the country of putting seniors first. And I think it's because you have all kinds of folks from the community and all different areas that have come together. So we want to continue to be here to help this site. We want to help the additional church sites as those requests come in. We want to be here to be able to help the folks here in Jacksonville. And I think if we continue to get more Pfizer, which it looks like the production's going up, we'll have the Johnson & Johnson. We could hopefully, really get the vast bulk of the senior population done in Duval County within the relatively near future. So it's exciting, and we're going to keep working really hard to continue to get the shots in the seniors' arms. Yes, ma'am. Well, so the next step for the general public will just be to lower the age, and that is going to happen. But I don't want to say you're going to be able to do it next week if I don't know what the vaccine situation looks like, and I'm not sure about the demand for the seniors. Now, I do think there are some signs in places that are well over 50% of their seniors that it is softening a little bit among seniors. The way I look at it, you have 4.5 million seniors. At least 2 million of them would have crawled over broken glass to get this. I mean, they're online, they're doing whatever. They really wanted it. then you probably have a certain amount, and I don't know if that's 500,000, 1 million, who just don't want it. That's their choice, and we obviously want to make it available for everyone, but we're not going to mandate it for anyone. And then you kind of have folks in the middle who aren't opposed to it, would take it, but are not going to kind of go out of their way. And so I think the more you get into communities, I think you get some of that group to get in. We were down in Hernando yesterday, and it was a senior community, mostly manufactured homes, and they were coming in on their golf carts. And I think some of those folks, if it was just them having to get an appointment at a pharmacy or something, probably wouldn't have done it. But because it was there, they were able to do it. So we just have to look at that to see. But people, I've said from the beginning, we are going to lower the age. And as soon as we're in a situation where the seniors are being taken care of, we're going to look to do that. I think we can do the law enforcement and the classroom teachers just given some of the additional vaccine without really impacting the 65. I mean, that's a decent number of people, but if you expand it to 55, that's millions and millions of people, and so then we'd end up having the jam and all that stuff again. So it's going to happen, I would say, without question, barring any problems with the vaccine distribution, you're going to see the age lower at some time in March, for sure. And as soon as we have the metrics to justify it, we're going to let people know. But I would point out, people say, oh, well, these other states have all the plans of when they're going to do it. A lot of those plans haven't worked out. I mean, they've had to change their criteria from the beginning. They had plans in December, had to shift. Most of them have shifted to doing what Florida's doing. And so we're going to continue with seniors first. If we're one of the oldest states, if we were one of the youngest states, we'd probably be done with the seniors by now. But look, we're going to be there for them. But you will definitely have access. And then what I think will happen is, because of the increase in Pfizer, because Johnson & Johnson will start getting produced more, I even think you'll see more Moderna. As we get into April, this thing is not going to be very difficult for people to be able to get. I think the supply is going to be very robust. So we're looking at, within the next 4 to 6 weeks, you're going to see this, I think, potentially really turn a corner just in terms of how ready access people have to it. Yes, ma'am.
School bus drivers have said that they also had a lot of contact with students since the school year started and kind of wanted people to go back into the classroom. We've seen in different counties there's outbreaks among school bus drivers. Clay County, there's a driver that passed away sadly. Are you thinking of also expanding it to school personnel and school bus drivers when you're talking about the federal site and possible traffic?
Yeah, no, that'd be something we'd be open to for sure. I mean, at the end of the day, figure out who those folks are that have the contact, the classroom teachers, although the infection rates for them have been very low, and I think it's been very positive. But still, I think it's good for confidence, and I think people appreciate it. And so some of those, I think, are important. So, yeah, we would definitely look at that. Yes, sir.
There's been a lot of talk about the federal site opening up in Jacksonville, but not information available. Since you just said the state's going to be running that, people don't know.
We're still waiting to get the full details on it too. So I had to sign a thing to make sure that our fella could kind of run it with the National Guard. So we're going to do, but it's moving parts. And so as soon as we have all the information, we're going to put it out to the public, absolutely. But we're still trying to make sure we understand exactly how they want to do it. I think, look, it's a new administration coming in. It's a new idea. Sometimes there's just parts moving, but I think it's going to be good. And we're happy to be able to have those. So we hope to, I think the shots are going to start at the end of next week. But we hope to, at the beginning of this coming week, be able to put out everything so people know for sure.
They haven't told you anything about the mobile sites. I think that's what people were. Each site is going to have 2 mobile units that are going to neighborhoods.
Yep.
Have they told you anything?
Let me check with my folks, because I mean, obviously that's a staff-to-staff conversation. But let's just put it this way: we are going to get the information out, and maybe maybe they've given it to us. So we'll do it. We're going to do it. We know it's going to start next week for sure. And folks, obviously, we want the information out because it's a pretty significant amount of doses. I mean, we want those doses used, and we want those to go to good use. Yes, ma'am. Agape, do you want to handle how y'all are doing it?
Yeah, it's a lot of moving parts, okay? So what we are doing is we are partnering with various community organizations. My first attempt will be the neighbors right here in the Newtown area and making sure that they are vaccinated if they're interested in being vaccinated, recognizing that we don't want to be in their community and they not have access. So they will be first. We'll have a system that they will be able to register, and based on their zip code, if they're in the appropriate zip codes, then they'll be able to register for the site to get appointments. We will continue to work with various community organizations, Hispanics, African Americans, and Filipinos to make sure that they are able to get appointments, and we'll do those in blocks so that organization, whoever they identify, will come together, and we will bring them in that way. We are also working with independent doctors' offices located here in the community because they are not associated with the hospital. They don't have access to the vaccines, and so we're asking them to help us to identify those patients who meet the criteria right now, and then working with them to send them over. So that's how we'll do it.
That's great. And I think doing it the way they're doing it with, you know, from a community perspective, when you're doing, so the hospitals had it, right? And then they would set up systems. But man, I mean, everyone was doing, like, it was a melting down. When we did the retail, we opened the first 3 retail sites in Hernando, Citrus, and Marion. I had people from Key West that were trying to get appointments to go to the Publix pharmacy and traveling all over. So when you have it on the smaller you have the overall with the community, working together with community partners, it's easier to get those folks signed up who may not be the first on the internet or maybe the first that. And so I think what they're doing is the right way, and I think the doctors are going to play a bigger role as we go forward. Our first shipment, we were only allowed to give to 5 hospitals, the Pfizer. Then we gave to the other hospitals when we had the Moderna. But we were not permitted to give to doctors' offices at the time. Now, they did, some of them work with county health, and we were able to do some of that, but we really want to work with the physicians. And from our perspective, getting more vaccine just into physicians' offices, that also takes some of the pressure off some of these other things. But I think they're doing it really well. We want to continue to be supportive so they can count on us to continue to source the vaccines. And if you find yourself being able to go through more than the daily allotment, let us know, and we'd be happy to look at increasing the dosages. Thank you.